Hi, this is John McMath with the Sciatic Pain Terminator, where we help thousands of people get out of their lower back or sciatica by getting to the root cause source of the problem so they can go on and live a healthy and happy, pain-free lifestyle. And a question I always get is, when should I go see a doctor? Now, there are 3 instances where you have to go see a doctor or emergency room right away. The first one is if you have paralysis or some weakness in your lower legs. Definitely need to go see a doctor or emergency room. The second instance is kind of obvious. If the pain is just so darn bad you can't stand it, definitely need to go see a doctor, or if it's at night, go to urgency care or emergency room. And then the third, and this is the one that's most often missed, is if you lose control of your bowels or bladder, meaning you can't control when you pee or poop. That usually means you have a herniated disc through the rear, which is where all those nerves are, and it's compressing those. And that is usually emergency surgery. So that you have to take that very seriously. If that happens to you or to somebody you love, get them to the emergency room right away, because they're going to, like I said, probably going to have emergency surgery for that. Now, fortunately, if you don't fall in those 3 categories, there's over an 80% chance that you don't need to see a doctor at all. The back pain is what's called acute, which is very short-lived, whether it's caused by a muscle spasm, putting pressure on a nerve, or something else going on, that can be handled by a few ways. The obvious is a little bit of bed rest, something like Motrin or Aleve or some of the other brands of medicine, non-steroidal. You can get in a position, depending on, my therapist calls it the leg up on the chair or leg up on the couch position, or the contour position, to relax the psoas and your hip flexors. You can do ice, which gets rid of or helps get rid of the inflammation, and then you can alternate that with heat to get the blood flow back in the area. And we do have a video that we talk specifically about how to do the ice and the heat, because there is a pretty strict protocol, and if you don't follow it, it's not very effective. So if you do that and about a week goes by, then you probably should think about seeing your general practitioner. And everybody should have a general practitioner, because they're the hub of your medicine. And then they'll pass you off to the specialists, which are the spokes. Call it the hub and the spoke theory is medicine. It's the way I like to look at it. Now, that can be a little dicey. Why do I say that? Well, if your job requires that you got to be there the next day, if you don't have insurance, or if your insurance, you have to wait a certain amount of time, there's so many variables here that determine when you can go to a doctor. So if you take the money and the insurance out of the equation, and also your pain tolerance too, you have to consider that. You know, do those things, give it a few days, and really be strict to it. And if the pain doesn't go away or doesn't get any better, then you need to go see your general practitioner. They can make more of a clear-cut diagnosis, or send you off to somebody who can, and then get you on your way to a pain-free lifestyle. Now, if this was 10 years ago, that would be your only option. But since we have the internet, you can look on the internet and look at videos like this, and also be able to better determine maybe what your problem is. And that's what we do at the Sciatic Pain Terminators, is help people get from point A to point B in the straightest line to a pain-free lifestyle. So those resources are available for you as well, while you're trying to figure out during this, holding period of a few days. You can look on the internet for those resources to help you get out of pain that much quicker, or at least help you make a decision on what to do next. So hope this video was helpful. Please comment on the blog below email me personally. I look at all of them because I deeply care about helping you or a family member getting out of pain. So this is John McMath from the Sciatic Pain Terminator, wishing you and your family a pain-free lifestyle.